Welcome to ED&A. Appreciate you all coming on this nice, warm summer's day. Yeah, I know it is cold out this morning. The wind has been awful. All right. I know Senator Prentice she has 4 bills that she has with us today, and Representative Hacken Phillips, you're going to fill in introducing Senate Bill 182, I understand. So, good morning, welcome. The floor is yours.
Good morning, Chairman Pearl and members of the Senate Executive Departments and Administration Committee. For the record, my name is Representative Mary Hacken Phillips of Grafton 12, representing the communities of Hanover and Lyme. I'll be introducing SB 182 on behalf of Senator Prentice, the prime sponsor, this morning. SB 182 was filed at the request of the New Hampshire Department of Health and Human Services and addresses changes needed to the statute that establishes and governs New Hampshire's multidisciplinary committee charged with conducting comprehensive reviews of deaths that occur during or within a year of pregnancy, which are known as pregnancy-associated deaths, presently known as the Maternal Mortality Review Panel, or MMR panel. The proposed legislation seeks to amend RSA 132:29 through RSA 132:31 to update and revise the Maternal Mortality Review as follows. 1, to change the name of the MMR panel to Maternal Mortality Review Committee, or MMRC. 2, to revise the definition of a pregnancy-associated death to include death of a woman while pregnant or within 1 year of the end of pregnancy, irrespective of the duration and site of the pregnancy, from any cause related to or aggravated by her pregnancy or its management. 3, to specify the institutions administering and facilitating the MMRC, New Hampshire DHHS, facilitating jointly with the New Hampshire Perinatal Quality Collaborative affiliated with Dartmouth Health. 4, changes to committee membership, including a representative from the Division for Child, Youth, and Families and the Department of Corrections. 5, authorizing compensation for mileage. And 6, secured access of the MMRC and its abstractors to certain protected data. Mr. Chair and members, please note that this legislation will have bipartisan support in the other chamber where I serve if it should pass through this committee in your body. And members of the Department of Health and Human Services are here to speak on SB 182 today, to take any questions, of course, that the committee might have. Thank you so much for your consideration of this bill, and please let us know if there are any questions or if you need anything else from us. Thank you so much for your generous support this morning.
Thank you for your testimony. We appreciate it. All right, we'll bring up Abby Rogers and Erica Tenney from the department. Good morning.
Good morning, Chairman Pearl and members of the committee. My name is Abby Rogers. I'm the Legislative Liaison for the Division of Public Health Services.
Hi, I'm Erica Tenney. I'm the new Maternal and Child Health Section Administrator with the Bureau of Family Health and Nutrition in the Division of Public Health.
Thank you. I want to thank Senator Prentice for sponsoring this bill, which is department requested, and also thank Representative Hacken Phillips for filling in today. The department is in support of SB 182 relative to the Maternal Mortality Review Committee. As Representative Hacken Phillips described so well, the legislation provides minor revisions and clarifications to RSA 132:29 through 31, which governs the Maternal Mortality Review Committee, which we refer to as the MMRC, to clarify statute and improve functionality and critical work of the committee. The statute was in need of an update, and also with this needed update will allow us to then further update our administrative rules. As Representative Hacken Phillips said, the Maternal Mortality Review Panel, as it was referred to in statute, is comprised of a multidisciplinary group of appointees, including OBGYNs, maternal and child health, fetal medicine specialists, the medical examiner, representatives from the community mental health centers, the state epidemiologist, as well as DHHS maternal and child health staff. In our testimony, we have highlighted at a high level with specifics on page and line numbers, the changes in the legislation. So we are in support of this legislation, and I think she covered it very, very well. I don't know if Erica has anything you'd like to add more about the MMRC.
Sure. So the MMRC, receives only de-identified case narratives about maternal deaths. No medical records or PII are shared. Specific hospitals and healthcare institutions, including geographic locations and addresses and names, are all redacted. The members and partners of the MMRC implement recommendations based on case review data to inform clinical care quality improvements, provider education, and policy interventions. For example, New Hampshire birthing hospitals are currently participating in evidence-based quality improvement programs for substance use disorder and perinatal mental health conditions, as those have been found to be the most contributing factors to maternal deaths in the state. There are also efforts to reduce maternal deaths due to cardiac and cardiovascular causes and other complications. These include clinical education sessions on treatment and prevention of thrombosis in pregnancy, amniotic fluid embolism, and profound cardiac decompensation during labor and delivery. The New Hampshire MMRC is committed to continuing comprehensive review of all cases of maternal death and identifying opportunities to eliminate future maternal deaths in New Hampshire. Thank you for the opportunity to provide testimony of the proposed legislation. I'd be happy to take any questions from the committee.
Great. Well, thank you both. Questions? Senator Reardon?
Thank you, Mr. Chair. And this is really a curiosity question. It sounds like the mission and the focus of the committee is really about physical causes of death. And when I saw the Division of Youth of DCYF and DOC on there, I was thinking more behavioral or environmental kinds of things, but with redacted names, you don't go there. That's not part of this committee's charge.
Thank you for the question. The committee looks at redacted data and does a case review of every maternal death. The addition of a representative from DCYF and corrections would help us to just get a fuller picture of challenges that women may face with postpartum and different social economic or situations. So that would just inform our committee to have those two positions or appointees added.
Follow up. So the goal of this committee would not be intervention in any way. Is that just a referral?
Correct. Right. It's basically a committee that reviews the case review of a maternal death, makes recommendations, and how to prevent for future deaths, looking at the information, the redacted information that the group has.
Great. Thank you.
You're welcome.
Further questions from the committee? I think you sort of answered this, but I guess why change the name? I guess just for a little clarity for me.
Yeah, I believe that it's federal recommendations that I think that it was Maternal Mortality Review Panel was what we were using. The statute was put in place in 2010, and the updated recommendation is to use committee.
Okay. Yeah, I caught a quick sentence in here about that. So does this use information like, we've had a bill on live birth worksheet many times in this committee. Does this use information like from that worksheet and others similar to it? Or?
No, this is different. This would be related to specifically maternal deaths.
Right. Okay. So, all right. That's what I thought. I just wanted to be clear on it. Any further questions from the committee? All right. Seeing none. Thank you both.
Thank you.
That's all I have on the sheet. Anybody else that would like to testify on Senate Bill 182? No? All right. Seeing none, we'll close the hearing. We've got about 5 minutes till the next hearing. Do you guys want to exec this one? You okay with it?
Motion to go to.
All right, motion to exec, moved and seconded. I know you just got in. Are you okay?
I'll abstain.
Okay. All right.
If that's okay with you.
Fair enough. Yep. All right. All in favor of going into exec? All right.
Aye.
All right. So do we have a motion on Senate Bill 182? Is it moved and seconded? And any discussion? Seemed like a pretty straightforward bill to me.
I'll leave it to the experts.
All right. All right. All in favor? Aye. And you wanted to abstain, you said? So it'd be 3-0. All right. Consent?
Second.
All in favor? Aye. Senator Reardon, would you like to take this one up? All right. Yes.
Senator, would you abstain from the consent vote?
You did abstain from consent vote?
Sure.
Yeah, okay. So it'd be 3-0. All right, we still have 3 minutes for our next hearing. Is there any other quick bills? Okay. Any other quick bills that we receive? I'm going to pass this out to you, whether we do anything with it right now or not. This is on Senate Bill 95. Senator McConkey has provided language that he has worked out. This was the summer camp bill. We emailed it to you last night. I'll give you the extras. So, does anybody, are you all okay with this language that they've worked out? It looked okay to me. If you are, we'll do this real quick, and if you want a little time to think about it, we can do it later on.
Do we know what the fire marshal?
Yes, everyone, I think I gave you the email too. Did I give you that copy? It was an email cover letter. Okay. If I could have that back, sorry, my bad. So the fire marshal, Toomey, as well as Woody Scott Brody and their fellow camp owners are all on board with this amendment. So this was all negotiated by them, and they were all in favor. So, what's the pleasure of the committee? Do you want to exec this now?
Sure.
Okay. All right. Could I have a motion on Senate Bill 85? Anybody want to make an ought to pass?
95, right?
95.
I'm sorry, 95. My bad. Bad eyes, I guess. Senate Bill 95, and Senator Reardon has moved ought to pass. Do we have a second?
Yes.
Second. All right, and I will offer as a committee amendment the language that I just presented to you from Senator McConkey, with working in correlation with the fire marshal and the other fellow stakeholders. So I'll move ought to pass on the amendment as a committee amendment. Second. Do we have discussion? All right, seeing none, all in favor of the committee amendment as presented, say aye. Aye. All right, and then Senator Reardon moved ought to pass as amended and was seconded by, I forget which one of you seconded it. So this vote will be on ought to pass as amended with the committee amendment with the language that we just adopted. Any discussion? All right, seeing none, all in favor? Aye. Any opposed? Move consent?
Yes.
Move consent, seconded, all in favor? Aye. Any volunteers take this one out? Senator Gandy, you want to take this one out? All right.
Happens with no air conditioning. My kids won't stay there.
There you go. All right, and with that, we have a motion to come out of exec.
So moved.
All in favor? Aye. And we are right on time. Do we know who's introducing the next bill? Is she here?
She's introducing what makes it just right now.
Okay. 1 minute?
Give or takes it, but yeah, anyways.
All right, so I think what we'll do, since we have a couple of people to testify, Senator Reardon, would you just introduce the bill, and then when Senator Prentice comes in, we'll let her speak to it? Thank you. All right, we'll open the hearing on Senate Bill 189. Senator Reardon is going to introduce the bill.
Good morning, Chairman Pearl and members of the Executive Departments and Administration Committee. I'm here on behalf of Senator Sue Prentice to introduce Senate Bill 189 relative to fetal death records.
Thank you. All right, we will call Kristen up. Good morning and welcome.
There we go. Good morning. Thank you, Chair. My name is Kristen Martino, and I am the Registrar and Director of Vital Records. I am working with Senator Prentice on this bill, and this is to modernize and improve our existing process for filing of fetal death reports. So before I get into the process of what we were seeking to do with this bill, it's important for you to understand that what a fetal death is. The best way to explain a fetal death is with a term that most people are familiar with, and that is a stillbirth. So think of this as a stillbirth. Fetal death is a stillbirth that happens to meet certain parameters within our statutes as being reportable, which is by weights or weeks, Fetal death is not purposely induced. Induced terminations of pregnancy are not considered fetal deaths and are not reported as such because they involve a purposeful interruption of pregnancy. So again, this is a stillbirth. All states collect and report fetal death data to the Center for Disease Control, or the CDC, as you may know them. Most states, including New Hampshire, report fetal deaths of 20 weeks gestation or more, or 350 grams in weight. So whichever one is the factor that creates this as to be a fetal death, those are the ones that we're reporting to the CDC. Under RSA 5C5, New Hampshire follows what is known as the national standard for all birth, death, and fetal death records. One purpose of the national standard is to provide uniformity in information that is being collected and analyzed to ensure consistency in data used in health statistics. Enclosed in your packets that just went around, I have provided a copy of both the national standard and New Hampshire's existing fetal death report form. You will notice that New Hampshire very closely follows the national standard. The only real difference is we happen to collect more on our disposition information. As to the filing process, currently when a fetal death occurs, the birth attendant manually, pen to paper, using that New Hampshire form, fills it out and mails it in to the Division of Vital Records, where it's reviewed by our death coordinator for completeness. Most of the time, the fetal death forms are incomplete, requiring our death coordinator to contact the hospital for further information, sometimes multiple times on the same record. Once the required information is obtained, the death coordinator files the record into our electronic vital records registry system, which we refer to as Nevern Plus. So throughout my testimony, you might hear me referring to our system as Nevern or Nevern Plus. One of the main purposes of this bill is to allow a hospital or an institution that regularly electronically is filing birth records, so basically your hospitals with an active maternity ward, to also file fetal deaths. That's where the bulk of these are occurring. Hospitals and institutions without maternity wards are going to continue using the paper fetal death report form. There's thankfully a very low volume of fetal deaths occurring with New Hampshire. Shall I keep going, or would you like? Okay. So there's thankfully a very low volume of fetal deaths occurring within New Hampshire. In 2023, there were 44, and in 2024, we had 32. Of the 32 fetal deaths in 2024, 31 of them occurred in a hospital with an active maternity ward. So only one of them occurred at another location. It could have been another hospital that didn't have an active maternity ward, or possibly this was at home. Although most fetal deaths occur in a hospital with active maternity wards, we anticipate this process will have a low impact on those facilities overall. New Hampshire currently has 15 hospitals with active maternity wards and 3 birthing centers, all of which report the births electronically. So each of these hospitals with a maternity ward already has somebody on staff who's keying these records on. We would anticipate that that role would also take on the keying of fetal death records. The benefit of allowing the hospitals to enter the records will provide a far more efficient method and will result in more timely filings. It'll eliminate the back and forth queries between the Department of Vital Records death coordinator and our hospitals. Another benefit of filing electronically is the ability for a burial transit permit to be issued from our Nevern Plus database. And you will see, if you look at the bottom of the New Hampshire fetal death form, there's a burial transit permit. Currently, that's being filled out at the hospital by a funeral director. So when a standard death certificate's filed, so we're talking a regular death record where if I were to pass away, once the filing is complete, a burial transit permit is automatically generated through our system. By updating the fetal death filing process, we are bringing their burial transit permit process into compliance with a standard death certificate. This will only apply to fetal deaths that are filed electronically by hospitals or birthing centers. Pen to paper will still sometimes be needed. So if a death occurs in a hospital that doesn't have an active maternity ward, they'll still have to use pen to paper. So for example, if this process was in place during 2024, 31 of the burial transit permits would have been issued via Nevern Plus, and 1 would have been issued with the pen to paper method. So it would have taken care of a lot of possible discrepancies and errors. We anticipate a low impact on our New Hampshire licensed funeral directors, as unlike a standard death certificate, they will only be responsible for entering disposition information. This is also seen as a potential benefit to funeral directors, as it is often difficult for them to obtain all the information they needed for a pen-to-paper method while they're at the hospital. Often they have been contacted to pick up the remains, but have not officially met with the family to obtain all the information that they need. And this allows them to obtain that information later so that they can carry out their duties efficiently without having to immediately disturb a grieving family. A final benefit is to the parents who wish to obtain a copy of their fetal death report and or a certificate of stillbirth. When a parent requests a copy of the fetal death report, current practice is to provide a photocopy of the handwritten form. If the parent also wishes to purchase a certificate of stillbirth, the current practice is to create a document in Microsoft Word, and then we print it on a just generic certificate paper like the kind you'd buy at Staples. So if passed, the division would then be able to electronically generate these documents from our Nevern database. They'd get a transcript of the fetal death report, and if requested, they could get a certificate of stillbirth, which would actually print out in a closely aligned manner as to our existing vital records like births and deaths, and it would be on our vital records safety paper. The current process is more cumbersome as it takes time to locate records and prepare the documents. So not only will our division be able to move more quickly and efficiently to locate and issue records, the records themselves are safer, more secure, and easier to preserve. The proposed improvement will also provide more professional documentation that would be issued to the parents to memorialize, acknowledge, and commemorate their loss. Finally, there is no fiscal impact with this bill, which is nice because the fetal death module already exists within Nevern Plus. This is all currently just being handled internally. We are seeking to open it up and allow for users at the hospitals to register to use it with us. Thank you for my testimony.
Thank you. Senator Prentice, good morning and welcome.
Oh, Kristen. Senator Chair Pearl, thank you, and I am sorry about being a few minutes late, but it seems that Kristen, who used to be my city clerk, so it's nice to have the opportunity to work together again, has really laid out the has really laid out the nuts and bolts of this. And primarily in coming in and introduce this, what I wanted to say is that we are just clearly aligning this, moving it from a paper process to an electronic process, which as a former, I spent some time working as an associate deputy medical examiner and, completing the electronic part of death records on the side before they go to the department. We were already doing this and working with hospitals to do this for adults. So it aligns that. It has a low impact because fortunately, we see less than, 45 fetal deaths a year. We want to keep it that way and lower it, but it doesn't have a high impact. I appreciate that the department has taken the time also to to take the opportunity not to make substantive material changes, but to again put this in an electronic format. But they've done things like said there's data points that we don't need to have. There's an amendment that's going to come to you that I have at OLS, but it'll do something like remove the Social Security number. Okay, ancestry, things that we don't need. There's a few of those that are taken out, which aligns it and makes it a more efficient system. So we are asking here, and it's never a simple ask. Everything has a level of, of complication, but we want to align the process from paper to electronic. It's going to make this better for the families. It's going to make this better for the funeral directors, and it puts the one system in place versus working half paper, half electronic.
Sure. So you want us to hold this right now?
I have an amendment over at OLS, so it's not here. Did you bring copies of what it'll?
I did.
The well-organized
Okay.
former city clerk, Kristen, has, and I'm so proud to see you down here working with us in Concord. It's like a big win for the Secretary of State's office. She's got a copy of the amendment.
They're in the packets that I handed out.
Yeah. So it's up to you, but I would hold it till it's all put together in one.
If you've got an amendment being drafted, we'll just sit on this. It's not an FM. We got time.
Yep, it's at OLS.
That way you'll make sure it's correct and you have everything aligned in the way you want.
I will do my best.
All right. Thank you.
Thank you, Senator Pearl.
Any questions from the committee? Seeing none, thank you both. Chris, did you want to speak too? You were on here but didn't check the box.
No, I'm just here in
Just for
support in case
support.
there were questions that exceeded Kristen's.
Okay.
I am a licensed funeral director and such, so if there was any specific questions, I can help.
Awesome. Well, thank you both. And
Thank you.
anybody else want to testify
I'm so sorry.
on Senate Bill 189? Seeing none, we will close the hearing. Can I take a motion to go back into exec? All in favor? Aye. We need to go back and reconsider Senate Bill 182 because of a technical situation that I did not realize existed. We have no provision for anyone to to abstain from voting. So, Senator McHugh, how do you want to handle this? Would you like to vote on this bill, or do you want to go get a drink of water?
I'll be right back.
All right. So I'm going to make a motion to reconsider Senate Bill 182. Do I have a second? All right. All in favor? Aye. Now, would you like to make a motion for ought to pass?
Second.
Moved, seconded. Any further discussion? All in favor? Aye. Move consent. Second. All in favor? Aye. And I forgot who we had taken this out. Senator Gannon. All right. Senator Gannon, we'll assign that back to you again. Thank you. And with that, I'll take a motion to come out of exec.
Second.
All in favor? Aye. Thank you. All right, we have about 3 minutes before we can open the next hearing. So we'll have a 3-minute recess, and then we will bring Senator Prentice up to.
3 minutes.
Yeah, I have to wait till 9. Our advertised start time is 9:30. Abby, did you want to testify on this one too?
Just ask her to join me.
Okay, if you're gonna, I'm just gonna have you sign up on the sheet, okay? Yeah, send it. Oh, they'll bring it to you.
The department asked to file a bill.
That's fine. Yep.
Move the process along.
All right, being 9:30, we're going to open the hearing on Senate Bill 190, and I will recognize Senator Prentice to introduce. Good morning and welcome to EDNA again.
It's great to be here. It is back in my first term. I served on EDNA, so it's always nice to be. It's always nice to be back in this room. Okay, for the record, my name is Sue Prentice. I'm a state senator from District 5, serving a large part of Grafton County, part of Sullivan County, and one wonderful town in Merrimack County, the beautiful town of New London. I am introducing, at the request of the Department of Health and Human Services, Senate Bill 190. So what we are striving to achieve here is to change the quorum requirements while meeting with our 91A obligations for both the state health assessment and health improvement plan, which we call SHIP. They have an advisory council. And then there's a commission on interdisciplinary primary care workforce. So these are two different groups that are based out of Health and Human Services. In the state health improvement plan, I just very briefly want to say, you know, it is a tool that charts the course to improve health in New Hampshire. It identifies priority areas like diabetes, heart disease, stroke, things that are impacting the state's healthcare, public health landscape, and sets out a strategy to actually combat these so that we have a prosperous, healthy New Hampshire. So it's working to make improvements. One area of the SHIP that I've had interaction with is an emergency preparedness for public health. There was something that back in my day and working in state government, even after that, that is an area that the state health improvement plan said we've got to do a better job when there is a public health emergency. And we're talking, conversation was 10 years ago in how we respond to this. And we use the SHIP as our tool to bring about changes within state government. So it's a really important group, but it is huge. The committee or the council is quite large. There are 39 members. So you can see getting a quorum, and both of these provisions are about getting quorums but meeting the 91A requirements. So it allows for 39 members, if you have 1/7 in the room, which is for the first, for the SHIP would be what I rounded up to 6 members. The rest can participate electronically, but they have to follow the same rules by 91A. They have to be able all in, synchronous, be able to hear each other, see each other. There have to be roll call votes. So it is all held to that standard should there be a hybrid meeting. I think that's always important in terms of the role of 91A and transparency. The second provision or section of this bill talks about speaks to the same issues with the interdisciplinary primary care workforce. Again, another group that is focused on bringing all the different disciplines of medicine together to identify problems, to build strategies, and to work towards always having healthy, prosperous, inclusive communities. Here, there are 23 members. So they have had issues making a quorum. And whenever we don't make a quorum for either one of these, it impacts the ability to plan, to study, and to move forward. So here we'd be going for 1/7 physically in the room. Others could be remote. And actually what I should have said on top of all of this is that we never discourage people from coming in person, but it gives them that option. Should it be a snowy day? Or should they live far away? Or should they maybe, have sniffles and should be staying home, not in a room, potentially spreading illness amongst other people? That all being said, it's 3.2 to 4 would need to be in the room for this to be a hybrid meeting, and it would be in compliance. Again, synchronous, everybody has to hear, see, roll call votes. All the 91A provisions will need to be met. So that's what I am asking the committee to consider so that we can keep these groups working for a healthier New Hampshire. Because right now, with the size of the size of the numbers and the quorum requirements, they aren't able to get there.
Thank you.
So I'll end my testimony there. Happy to take any questions. And again, this was a request of DHHS.
Sure. Abby, anything you want to add?
Sure. I just wanted to, hi, this is Abby Rogers. I'm the legislative liaison for the Division of Public Health Services. To thank Senator Prentice for sponsoring this bill. It was at request of DPHS. These two commissions, the Interdisciplinary Primary Care Workforce, will look at the crucial issue of healthcare workforce in the state, and also the SHIP Council. And my colleague Whitney Hammond is here to provide some more information on that. Both of these have been struggling with being able to meet the quorum requirements. There are multiple reporting requirements as well for these commissions, as well as voting. So this bill would really help to increase the functionality of these very important groups.
Thank you. Well, my first question was going to be, does it meet 91A? But that's already been answered, so we're good with that. Further questions from the committee? All right, seeing none, thank you both, appreciate it. Whitney, we'll bring you up next. All right. Good morning and welcome. I'll turn your mic on, please. Thank you.
Good morning. Thank you for giving me the opportunity to provide some testimony. My name is Whitney Hammond. I'm the Interim Deputy Director for the Division of Public Health Services and the Department of Health and Human Services. I wanted to just give a little bit of context to the SHIP Council and why the membership is so large, at 39 people, as Senator Prentice mentioned. When RSA 126A 81 and 82 were passed, which established that council and their charge, the intent was to have a really broad membership that went beyond our sort of typical health, public health, and healthcare partners, so that this state health improvement plan would actually be broad and address social needs related to health. So the 40 different positions are across a really broad sector of partners, and you'll hear later from Ed Shanshala. We also have statewide representation from everywhere up to the northern part of New Hampshire and the southwestern part of New Hampshire. The council has been meeting monthly. We take summers off, so we have about 10 meetings per year. Interestingly enough, the attendance in person is right around the number that we would have if this bill passed. So we regularly have around that many people who come in person, and then we have pretty good participation virtually. And we've been doing a really good job of being fastidious about having people have their cameras on and having people report why they're not able to participate in person. So being able to have a quorum and vote on official business and approve our state health assessment and our state health improvement plan would really help the council to become more effective at our charge from statute. That's about all I had. I'm happy to answer any questions.
Great, thank you for your testimony. Any
Thank you.
questions from the committee?
Any questions? No?
I think you've done a great job in explaining it. Ed, do you want to answer them too? All right, give it right to the aides here, please. Thank you. Good morning and welcome.
Welcome. Thanks for having me. My name is Ed Shanshala. I am from the North Country, so I drive down on a regular basis for good purposes.
You had a nice cold ride down this morning.
I got my cup of coffee in Ashland, so it was all good.
Well,
And I have the privilege to co-chair the Shawship, and I've seen a lot of wonderful ideas that we've been able to actually start to take out into our communities. Because my goal was to have a state health improvement plan that was increasingly accessible and actionable at a hyper-local level, that your friends and family and neighbors could look at it and go, oh, I could see what I could do toward achieving some of this at a hyper-local level. So the bill before you, I think, really greatly enhances our ability to be effective and efficient, and at the same time honor the transparency and the RSAs on the books as it relates to good governance and good meeting hygiene. So I'm here to answer any questions you may have. I actually do like to come down. It gets me out of the North Country periodically to come down and co-chair it, which has been enjoyable. And the things that I've learned from colleagues from across the state are actually pretty significant, and I get to take that back to the North Country. My day job is I run the Ammonoosuc Community Health Services in Littleton and across 26 towns. So it's, I'm constantly looking at how do I take this ship and integrate it into our strategic plan in primary preventive care.
Sure. Well, thank you for making the trip down and testifying in front of us today. We appreciate it. Do we have any questions from the committee?
Right.
All right. Thank you, Ed.
Thank you kindly.
Anybody else who would like to testify on Senate Bill 190? All right. Seeing none, I will close the public hearing. You're okay with us moving this one through, right? You're okay for this? No amendments to this one? No amendments. Okay. Take a motion to go into exec. Do a second. Moved and seconded. All in favor? Aye. Do we? Anybody want to make a motion on 190? Second. Moved and seconded. Discussion from the committee. I think it makes good sense, and again, I'm satisfied that they're meeting the 91A requirements. That was my main concern when I reviewed this bill, and we received testimony that that is in place, so I'm good with it. Further discussion? All right, seeing none. All in favor? Aye. Any opposed? Move consent. Moved and seconded. All in favor? Aye. Aye. Senator McHugh, would you like to take this one up?
No.
Nope. All right. Senator Reardon? All right. Okay, so this is it. What's that? Let's take a look real quick. We've got 5 more minutes. Let me just review and see if there's anything else we can do. Let me just quickly review. I am waiting for an amendment on 185 that I don't have yet.
consent, but not on that one.
179, I think that is. Yes. Senator Gray's bill, 179. Do we have an amendment for that ready?
She sent it to OLS. I agree that George is making a committee amendment, maybe?
If you have the language, if it's simple. Okay, we don't have to do that right now. We do have one more week, which I did not realize. Senate Bill 180, we have an amendment for. Kevin, do you have copies of that?
I have not received that amendment.
Okay, I do have it. So let me give you that, and you can make copies. I thought Kathy had sent it for Senator Rochford, but I have the amendment, so. What I'll do is we'll get copies and distribute that to all of you to review, and then when we go into exec after we're done with the hearings, then we can consider that, okay? I want to give everybody a chance to review it.
I have the amendment on my computer. If I send it to Kevin.
I just gave them a copy. They're gonna. Oh, the other one?
The other one.
Yeah, if you can do that, we can print it out, and we can have it for our next exec session when we come back. All right, with that, I'll take a motion to come out of exec.
Second.
All in favor? Aye. And we will start our next hearing in 2 minutes. All right, being 9:45, we will open the hearing on Senate Bill 202 and recognize once again Senator Prentice. I think she's our winner for the most bills in our committee this year.
If it's okay with you, could I have Jen Gordon and also speaking, as this is their request to join me?
Absolutely. I'll just, Jenny, after I'll have you sign in on the sheet, okay?
Oh, I like that. Yeah.
Oh, and there may be 2 sheets going. No problem. Thank you.
Thank you.
Senator, the floor is yours.
Great.
Once again, good morning, members of Senate eDNA, Chair Pearl. For the record, my name is Sue Prentice. I'm the state senator from District 5, representing 15 communities, a large part of Grafton County, and a little bit of Sullivan County, and one beautiful community in Merrimack County, the town of New London. New London always gets the shout out because they're there by themselves. That being said, I'm here today to introduce Senate Bill 202, and I'm going to talk you through for what we were initially introduced and the work that we've done to get this into a place where I think we can really make a difference in bringing the emergency, raising awareness around Alzheimer's, the approach to Alzheimer's patients and their care and treatment by our incredible EMS professionals. That's what 202 really strives to do, but within the system that we have, not trying to create a new system. And I'd like for the record, if it's okay, for Jenny to sign in, and then I'll introduce yourself, and then we'll.
Good morning.
Good morning, everyone. My name is Jenny Horgan. I'm the Senior Public Policy Manager for the Alzheimer's Association here in New Hampshire. I'm very excited to be here and very grateful to Senator Prentice for working with us on this piece of legislation.
Thank you very much. Okay, so I'm going to do the end. I always read the last chapter of the book first, and then I read the book. So when I had this amended and did a replace all, the methodology for the original bill is still in here. I don't know if that's a committee amendment or how we're going to handle that, but that will need to be struck out. And so now I'm going to go back to the start. So I was approached by the Alzheimer's Association about introducing legislation that would make a requirement at a minimum of 1 hour of education for EMS professionals that they would be required to do biannually in order to be, well, they have to keep their certification up, but as well as to be licensed. And although we value the education and we think it's important that the EMS professionals are, have access to this, the question was whether we wanted to require it or not. The Alzheimer's Association has done work in other states where they have been able to bring about such legislation and get it passed. But what's different about New Hampshire, there's a couple of things. We already have an infrastructure here for, in RSA 153A in particular, on how education, how requirements are set for education or are not set for education, how patient care protocols are developed by a group of medical providers, physicians that are appointed by the Commissioner of Safety, and then we also have a system-wide coordinating board which has representatives from not just emergency medical services but geographic regions of the state, the public, and different medical areas of specialty. These groups already have a system to evaluate and embrace these types of requests. So I felt it was unnecessary to bring this through to legislation. I'm also going to add, but I have a pathway to get this done, I'm also going to add that we are a state that uses the National Registry of Emergency Medical Technicians, and Senator McHugh and I know this well because we're both for certifying right now. They are our vendor for certification, and our state has deferred to them and said that what you require for recertification for paramedics, for EMTs, for advanced EMTs, is good with us. So the state doesn't take a position on requiring any particular type of material. They just defer it to the National Registry. It's always been this way. It's efficient, and it's actually meeting the national standards. So what we wanted to do, again, was to elevate this topic, get it out into the EMS community, but use the system that we have in place, which is working through the Medical Control Board, working through the Coordinating Board, as well as I've proposed in here that we are going to actually get a seat on the subcommittee for Department of Health and Human Services as a subcommittee that brings together stakeholders to address Alzheimer's issues, not Alzheimer's issues as much as education, awareness, and tackle any problems that might come up. And they have law enforcement on it, but they didn't have EMS. So here's what I'm asking you to do today, and then I'm going to tell you my plan moving forward. I brought for you a proposal, instead of requiring education, that we don't we don't make these requirements, we follow a national standard, is to amend RSA 153A, as well as amend RSA 126A. The 126A 15A is the Alzheimer's Disease Subcommittee to put a seat on this for emergency medical services to be along with law enforcement. So it just seems to me if we're going to start talking about how to work with the EMS community, there should be tandem places. So first, let's talk about and see if we can pass putting an EMS provider on the seat along with law enforcement. Secondly, the Emergency Medical Services Coordinating Board, after all these years, is still an incredible mouthful. Again, they have 23 members. It's a big group. We've already talked about big groups from throughout the state, different disciplines and different medical specialties that sit at a table every other month and work on these system issues and make recommendations for areas like if they wanted to advance education or advance a protocol, a medical operational protocol for Alzheimer's for EMS professionals, they could do it there. So my proposal with all that background is we don't have current requirements for EMS education. We follow the national standard. That's number one. Number two, the state of New Hampshire has infrastructure in emergency medical services that's in place to already bring about a change that is similar to this, not an educational requirement, but a way to do, and I'll tell you what that is. So we should follow the infrastructure that this body, that the legislature has put in place to get this done. And three, we should, at tandem with the Department of Health and Human Services, put an EMS professional on their subcommittee that works with Alzheimer's to basically balance out the law enforcement piece. And knowing the EMS professional could come from a fire department or volunteer department, that will be decided later. So those are the three key things. I will share with you that my plan moving forward, using the infrastructure in place, which is not included in this legislation, just so that everyone is assured that we're being very thoughtful about this community and we've collaborated on this, is that Jenny Horgan and I are going to go and meet with the EMS Medical Control Board, who first decides whether they should have a protocol for this, in March 20th. I know I keep referring with the 13th. We're going to meet with them in the morning of March 20th to present our case to get this onto the docket for development into a medical operational protocol that will roll out within the next 2 years. Here's why, again, following the infrastructure we have is important, but here's why that step is very important, is anytime we have a new protocol, there's an educational component that goes with it. So we'll be able to get this through the system that we have. We're just taking a bit of a detour and working within this current infrastructure. Okay, so I'm going to stop there. I hope that was clear, but again, infrastructure in place, following national standards, and we have a pathway to move forward to elevate the education around Alzheimer's disease within the EMS community. Stopping there, happy to take questions, as well as hear from Jenny at your discretion, Chair.
Jenny, do you have anything you want to add before we go to questions?
Yeah, no, I just want to say thank you again to the committee for hearing this legislation. Thank you to Senator Prentice for working so incredibly hard to raise this important issue. You know, I think that everyone is aware of the fact that Alzheimer's is a significant issue in the state of New Hampshire. 26,500 individuals live with the disease in the state, which is over 10% of the population 65 and older, and many more individuals do not have a formal diagnosis. So this is a significant portion of our population. And as I'm sure you all know and are very familiar with, people who are suffering from Alzheimer's and living with the disease have issues with remembering where they are. They can have behaviors of confusion, agitation, and especially in a situation where they may be lost or uncomfortable, they can become uncooperative, disruptive, and sometimes even escalate into aggressive behaviors. You know, the EMS personnel that they interact with, we're incredibly grateful for all of the amazing work that they do for this community. And they interact with them in a variety of situations, whether it be just a simple transportation of an individual or in a disaster situation similar to what Senator Gannon brought up earlier regarding the fire that happened at this weekend. You know, we're incredibly grateful, again, for the work of the EMS and fire community in supporting and getting everyone out safely over the weekend. And our intention here is just to try and create more communication and collaboration through the subcommittee and through the Medical Control Board to raise awareness regarding tools and education that's available to the EMS professionals in our state so that they have more tools to enhance the interactions that they're having with these individuals, to give them tools for communication, for engagement that will help them to better deal with situations where someone may not, be in a situation where they can be cooperative with an EMS professional. So again, we're really grateful to Senator Prentice, for our EMS community for working with us on this, and I'm happy to answer any questions.
Thank you. Questions from the committee? Looks like you did a good job. Thank you.
Thank you so much.
Don McKinney? Is Dawn here? Oh yeah, just look out real quick because I don't have anybody else. I want to give her the opportunity to speak.
Sorry, do we have Megan Wentworth signed up to speak?
No, I only have Don McKinney. Maybe you got on the wrong sheet?
I did put us on the wrong sheet. I'm so sorry.
That's okay.
So Megan Wentworth.
Megan, why don't you come on up? Okay. Where did Megan go? Oh, yeah, there she is. Come on up, sure. Good morning and welcome.
Good morning. Good morning, Mr. Chairman and members of the committee. For the record, my name is Megan Wentworth and I live in Dover, New Hampshire. I'm here today to testify in support of Senate Bill 202. I've had the honor and privilege of caring for those living with Alzheimer's and related dementia here in the Granite State since 2009. In the last 10 years of my career, I've worked as a director in various assisted living communities, specifically focused in memory care units. To say that Alzheimer's disease is my biggest passion would be an understatement. There's no greater feeling than helping those unable to help themselves. I've been lucky enough to have received a multitude of trainings throughout my career, which have resulted in not only certifications and licensure, but also a greater knowledge of this difficult disease. Any day I walk on my unit, I am met with a variety of behaviors and communication styles that an outsider would be astounded to see. I've helped a resident get ready for their wedding day, which took place in 1955. For about a year and a half, I was my 98-year-old resident's older sister, and I've been mistaken for a man more times than I care to admit. At the same time, I've experienced verbal slurs, angry outbursts, overwhelming distress, and combative behaviors directed to myself and others. It is in these moments that I am most thankful for my trainings, as they give me the tools to be able to de-escalate these situations without the use of pharmacological interventions. By meeting the resident where they are, or as I like to call joining their journey, redirection, one-on-one interactions, assessing the environment, and discovering what their unmet need is, I am able to decrease stress and meet the needs of the resident. In an environment that is already chaotic, adding a medical emergency only exacerbates any ongoing behaviors exhibited by my residents. With the addition of 3, 4, 5, or even 6 EMS responders on my unit, disruption and disorder is a given. It is the goal of everyone involved to make sure the resident in question is not only treated in a timely and effective manner, but also with respect and dignity. Unfortunately, with the lack of training, these interactions don't always go as smoothly as I would have hoped. Without a solid knowledge base, I have heard EMS correct a resident on what the actual year is, that the mother they are asking for is no longer living, that they are too old to be in college, that the 5-year-old daughter they are looking for is an adult now, that it is summer, not winter, and trying to reason and argue with them rather than meeting them where they are. These are only a few instances I've experienced in the 16 years of my healthcare career, resulting in more anxiety, distress, and confusion in a situation that already radiates those emotions. It is vital that we increase collaboration with partners in the EMS community so that we can ensure that our already vulnerable population isn't exposed to more instances of unnecessary distress, anxiety, and confusion, and that our EMS professionals have access to all of the tools they need. Therefore, I ask you to support this bill. Thank you so much for your time and consideration.
Well, Megan, thank you for your testimony, and thank you for the work you do. My wife has worked for 20 years in dementia care, and I understand the mental and physical stress that it puts upon you to do this kind of work. So we really appreciate you doing that.
Yeah, it's my pleasure.
Is there any questions from the committee? All right, seeing none, thanks for coming in and testimony. One last call for Dawn McKinney. All right, anybody else that would like to testify on Senate Bill 202? All right, seeing none, we will close the hearing. I see Senator Abbas is here right on time, so come on up and we will open up the hearing on Senate Bill 192 and recognize you to introduce. Good morning and welcome to ED&A.
Thank you, Mr. Chairman, members of the committee. I'm Senator Darrell Abbas. I represent District 22, and I'm here as the prime sponsor to introduce Senate Bill 192. And, excuse me, this bill, all it's doing is creating a study committee really to establish coordination between several different departments when it comes to sharing information, whether it's parole, probation, DHHS, in the correctional facilities. And to me, the lack of sharing information whenever any services or conditions, whether it's probation, parole, not sharing the information sometimes results in not always putting the best plan in place. And I've seen that in the private practice before. So this gets all the interest groups kind of to sit down, figure out the best way so they can share their information. I can just give you an example. I had someone who retained my services. They're already on probation, so their case was done. They were continuously flunking drug tests, all right? And now it wasn't even a drug-related offense. I'm not sure why part of his conditions, he was getting drug tested, but that's what it was. Anyway, he did have an untreated mental health condition that the probation department wasn't fully aware of. I mean, it was kind of mixed in the weeds, shall we say, but he had untreated PTSD, and obviously the PTSD is one of the side effects and triggering points of that is substance abuse. So they weren't treating the triggering point, is my point. What was causing him to relapse was not being addressed. So they were wondering why everything they were doing wasn't working, and it seemed that they didn't have the full picture. Had everyone shared the information, I think that maybe they wouldn't have needed me to point that out, and obviously would have got things on track faster. Also, you can have situations where there's conflicting conditions, whether it's, PCYF, if they're involved, they may have certain requirements that may conflict with probation, and going back and forth, and you have to sign release papers. It's really inefficient to get everyone on the same page, having to sign a bunch of different release forms and things change. So, and I think from just a fiscal side, the amount of money spent when there's a violation, it's the court system spending money, DCYF's going to be spending money. A lot of people are just spending administrative costs on dealing with something that should have been dealt with on day one, and it wasn't. And I think, this happens more often than we think. So I think getting everyone together would be a really good plan, obviously to reduce recidivism, and I think hopefully put the best plan in place. And I think that would benefit everyone involved. And I'll be glad to answer any questions.
Thank you for your testimony. I guess my question always is, do we have to have a study committee to get these folks to sit down and talk? Or do you feel there's another way we can do it? I mean, sometimes it takes a study committee. So have you thought about just asking the stakeholders to sit together and talk and see if we can find a path forward?
So this sounds very simple. Just let's all sit down, let's talk it out. Each department has different policies, different rules, regulations, guidelines that they have to comply with. So to come out with the best product to land the plane, shall we say, I think it would be better if everyone sat down and we did it formally and heard from everyone and put something together. And then obviously, you know, could I do this myself? Maybe, but I think if it's part of a study committee, we would probably get the best product, because you really want to have all the people that are in departments that are going to have to implement this to be on the same page. And that's the problem. It's not that they're fighting against each other. It's just they're handcuffed on what they can and cannot share.
Thank you. I appreciate it. Questions from the committee? All right. Seeing none. Thank you. Aaron. Thanks for coming in. I think it's Thorvaldsen, but I didn't want to butcher your last name.
Yes, you got it. It's a tricky one. So.
Well, good morning. Welcome to eDNA.
Good morning. Thank you. I do also have some written testimony from Jake Berry from New Futures in support. So. All right, thank you. Well, good morning. So thank you for the opportunity to speak today in support of Senate Bill 192. My name is Erin Thorvaldsen. I work for the Council of State Governments Justice Center. We are a national nonprofit, nonpartisan organization. And we have worked in New Hampshire since 2021, focusing on policy recommendations to address the needs of individuals who frequently cycle between DOC, DHHS, and county jails. And these individuals often have co-occurring substance use disorders and mental health challenges. So very much like the client that Senator Abbas spoke to earlier. According to our analysis, this population is very small, only about 8% of the overall population in the criminal justice system. But they account for a large number of resources and money, accounting for about $123 million over 3 years to incarcerate. These individuals are generally admitted to county jail or state prison for supervision violations. Such violations are often technical in nature, meaning it is not a new crime that is bringing them back to prison, but behaviors such as missing an appointment or alcohol or drug use. SB 192 is a critical step towards improving coordination across the state's justice and health systems. The proposed study committee will provide strategies and recommendations to implement a cross-justice system identification number, develop a unified client information system, and create real-time data dashboards. Each of these steps are informed by national best practices and highlight the importance of cross-system data integration and the use of unique identification numbers to better understand and serve the needs of individuals across correctional facilities, parole, and community supervision. Equally important is the development of a unified client information system to ensure continuity of care from incarceration to community reentry. Establishing integrated case management across county jails, DOC, and supervision agencies is essential to improve outcomes for justice-involved individuals. Best practices stress the need for real-time information sharing across health and justice systems, which can only be achieved by building systems that protect individual privacy while allowing for real-time data exchange. This aligns with New Hampshire's Reentry 1115 Waiver Implementation Plan, which prioritizes case management systems and services pre- and post-release to ensure timely access to community-based services and ongoing support after reentry. The creation of data dashboards will also play a critical role in improving transparency and enhancing the state's ability to respond to emerging trends. Best practices recommends real-time monitoring tools to track treatment outcomes, recidivism, and behavioral health needs. Dashboards offer a transparent and data-informed way to ensure that resources are targeted effectively and that outcomes are regularly reviewed and improved. Right now, agencies release annual reports with data that is often a year or more out of date. Decisions are made based on data that may or may not be applicable currently. Real-time data dashboards will allow agencies to make decisions based on data on the current state versus data and trends that applied years earlier. Finally, it's critical that all information sharing under this initiative complies with legal and privacy protections, including HIPAA and 42 CFR Part 2 regulations. Best practices emphasize the importance of developing data sharing agreements and training staff on how to navigate the legal complexities of information exchange while maintaining individual confidentiality. Ensuring that these privacy standards are met will build trust among stakeholders while allowing for the secure and ethical exchange of data. This proposed legislation aligns with national best practices for data integration and care coordination. It also reflects recommendations developed in collaboration with state partners to address the unique needs of individuals transitioning from incarceration to the community. SB 192 represents a significant opportunity to improve data-driven decision-making, reduce duplicative efforts, and experience cost savings across agencies. And most importantly, ensure that individuals receive the support they need to successfully reintegrate into their communities. I want to commend the sponsors of this legislation, Senators Abbas, Waters, and Avard, for their leadership in recognizing the importance of this issue. I urge the committee to support SB 192 to help build a more coordinated and effective system that can better serve your state's justice-involved population. So thank you, and I will take any questions that you may have.
Well, thank you for your testimony. Any questions from the committee? Looks like we're all set.
Perfect. You made my job very easy.
Thank you. Same for us. So we have one more person signed in, Jake Berry, who submitted testimony, who was in favor. Is there anybody else that would like to testify on Senate Bill 192? All right, seeing none, we will close the hearing. I'll take a motion to go into exec. Moved and seconded, all in favor? Aye. Well, we might as well start right with 192 if you guys are ready. We've got this bill still in front of us. Do we have a motion?
Sure. OTP.
Do you have a second? Second. Moved and seconded. Any discussion? Well, I would say I'm not always in favor of establishing study committees, but especially this year we've got to look very closely at that because we have limited services going to be available for us as we lose the LOB this summer to renovations. But as I questioned Senator Abbas, it appears it was pretty important to him to have this group get together, so I will be supporting this motion, and we'll figure out how to get it done. So, further discussion from the committee. All right, seeing none, all in favor? Aye. Any opposed? Move consent. Consent. Moved and seconded. All in favor? Aye. You know what? I haven't taken one out today. I'll take this one out. I want to do the, hold on one second, let me just write this down. The 181, because we have I've asked the firefighters to come and be here and talk with us. So if you guys want to come up for a minute, we'll do 181 next. I know the committee had some questions relating to some language that was in the bill, and I wanted to make sure that we all understood and had the opportunity to have our questions answered before we voted on it. So thank you for coming in. We appreciate it. And
thank you for having me.
I know we had a question related to the smoking language. So I don't know if there's anything you want to just quickly address and give the committee some info on that before we
yeah.
move forward.
For the record, my name is John McAllister. I'm the Secretary-Treasurer for the Professional Firefighters of New Hampshire and a 25-year member of the National Fire Department. It's important to stress to this board that language that you're referring to as the tobacco-free lifestyle was language that was added in this bill in 2019 when it was agreed upon and voted upon by with both parties. Sorry, and the bill was passed. So when we had submitted this language, we weren't. That language was not to be addressed. It was added in part of the bill because we had added a new section, so that section had to be shown because it moved down a tier. But the tobacco-free lifestyle, we followed the Affordable Care Act, the language from the Affordable Care Act from 2019, and that was the agreement that both parties had agreed that they would use for language.
Okay, thank you, John. The committee had considered adding vaping. Are
Yep.
you still okay with that?
Yes, we're okay with adding vaping if that's going to push this along and make this bill move along, we have no problem with adding vaping as well.
All right, thank you. Is there any other questions, Senator McHugh?
Thanks for coming back, Mr. McAllister. I know your intention wasn't that this group address that language, but in fact, it's usually a de novo review of the chapter,
sure,
or of the language, and regardless of the source of it, whether it came from Affordable Care Act, this is the New Hampshire State Legislature. We're going to review the statute regardless of the original source of where it. So I'm glad that this came up, because actually it gave us all a chance to learn that most departments actually have a more stringent requirement. So in our discussions, what we learned was there's a protection here that if there's some incidental, had a couple puffs of a cigar during vacation or at a legislative golf tournament or something like that, or a charitable golf tournament, that wouldn't immediately prevent or cause a claim to be denied that's clearly a work-related cancer. And that's why this language exists, where on the face of it, you might say, that's not really a tobacco-free lifestyle if somebody's smoking a pipe or a cigar 3 times a week. But in actuality, the departments, especially the health-conscious departments, impose upon their firefighter employees a more stringent requirement that's zero tolerance.
Correctly.
And so I'm glad we had the discussion.
Yes.
In the course of this de novo review.
Yeah, and thank you for the question, Senator, but you bring up a very good point. A lot of the fire departments throughout the state of New Hampshire do have their own tobacco policy within their respective department. And it's either zero tolerance while on duty or while off duty or vice versa. So we are addressing that. Our fire departments are taking the right steps to prevent our members from any outside sources of cancer that they might experience.
Oh, and if you could just also remind us again that there's additional requirements. Could you just remind us again about the additional requirements to meet the approved claim, that clear and convincing, that the 10 years on the job and the cancer-free physicals and all of those couple of steps, because that's quite a high threshold as I recall.
There is, and again, thank you for that question, Senator. So part of the policy is exactly like you had said. In order to fall in this to this claim, you must be a firefighter for at least 10 years in the fire department. Your fire department must take certain measures to prevent cancer within certain policies to help prevent cancer within the within that department. Some of those are having a second set of gear, a gear extractor to be able to wash and decontaminate our gear after a structure fire. So there are processes that we need to follow. We are starting to have yearly physicals and encouraging our fire departments and our members throughout the state to have these preventative measures of physicals, because as we know, early detection is saving lives.
Thank you. We really appreciate you coming back and providing some information. You know, the committees like to be diligent, make sure they're getting these things right.
Absolutely.
We appreciate you as a resource. Any further questions from the committee? All right. Thank you, John.
Thank you very much.
Is there a motion? Senator McHugh moves on to pass.
Can I just clarify before we do that?
Yes.
So on page 2, line 25, we're changing the wording to use any tobacco and then inserting or vaping.
We will. We'll do a committee amendment once we've moved to the ought to pass. So we have an ought to pass, and you want a second? All right. And then Senator Reardon wants to offer a committee amendment on line 25, adding the word or vaping. I'm sorry, where were we adding this again?
After the word tobacco.
Tobacco or vaping product. Okay, Kevin, are you clear on that? So the line would read, within the past 6 months, comma, used any tobacco or vaping product, comma. Okay, got that? Or is the committee clear on that? All right. Discussion on that before we vote? All right, seeing none, all in favor of the committee amendment of adding the words or vaping? Say aye.
Aye.
Aye. Any opposed? All right, so now Senator McHugh is moving ought to pass as amended, and Senator Reardon has seconded. And any discussion on the bill as amended with the committee amendment? All right, seeing none, all in favor? Aye. Any opposed? Any volunteers take this one out? You want this one? Senator McHugh will take this one out. Consent. Yes, sorry. Consent, do we have a second? All in favor? Aye. All right, now Senator McHugh will take it out. Thank you again. Appreciate it, guys. Thanks. Okay, give me 1 second to get organized here.
Assistance in the House due to those votes. That's the
All right, we must go right back to 180, which is the amendment that I passed out to you from Senator Rochefort.
I'm sorry, what did you say? Sorry.
Senate Bill 180, and that's the amendment. We have an amendment for that Senator Rochefort provided. Yeah. We hand it out here. I know we passed it out in the last break, and I'm certainly willing to give you the committee a minute to review the amendment if you'd like. I kind of need that too. So one of the questions in the interim that I spoke with Senator, Senator Rochefort about is one of the concerns that I had raised during the committee hearing was about the possibility of this actually working backwards and slowing down the process for the folks in the North Country, because that was certainly a concern that I came away from the hearing with, and he feels that it will not be the case and that this amendment helps to clarify that. And so I want to, I believe you'll find in lines 26 and 7 of the amendment that he has made, and maybe even 28, that he has made some changes there. Yeah, so there's some language that changes it there. He's removed the without imposing unnecessary burdens and consider and avoid potential impacts on the regional economy. All right, so do we have are we ready to make a motion on this? All right, so we have an ought to pass. Do we have a second?
Sure.
All right, Senator Gannon seconds. We have the amendment. I'll move Senator Rochefort's amendment to 2025-409S. Do we have a second? Discussion. Do we feel this amendment does what he's hoping it will do?
You think it does?
I think it's a little clearer. I'm hopeful that we're not going to pass something that's going to set the North Country back. That is certainly not our intention.
I'm not sure about the whole bill.
Well,
I believe when it comes to grant writing program eligibility, having a designation like this will have an impact.
that is my understanding. That is not admittedly, that is not an area of expertise for me, and so I'm not certain that I understand the necessity of this for the grant writing, but I certainly feel that we received testimony that this would be impactful in a positive way for them. So I will support it, and if the North Country feels that this didn't quite meet the test, I guess they can have a discussion on the others, on the House side, and make some changes.
I don't think it'll hurt. I think it will certainly help. The question is the precedent.
Yeah.
Right. I mean, I definitely think it'll help. I think they need it. I think it's not our concern what the other body may choose to.
Right.
So,
I say if the North Country doesn't feel this is exactly the right move, then they have the opportunity to make that discussion on the other side. That was
so. For our purposes, I'll support it.
Further discussion? All right. Seeing none, so we'll be voting on the amendment. All in favor of ought to pass on amendment 2025-0409S. Aye?
Aye.
All right, now we'll move on to the bill ought to pass as amended, and I apologize, I forget who moved the bill originally. Senator Reardon, and Senator Gannon seconded, so the bill will be ought to pass as amended with Amendment 409S. Further discussion? Seeing none, all in favor, say aye. Aye. Any opposed?
Nay.
Okay, so we have 3-1. Senator Gannon, will you allow this to go on consent?
Sure.
Okay, so move consent. All in favor? Aye.
Aye.
So the vote is 3-1. Senator Reardon, you want to take this one up? I do like this new consent rule. Okay. Senate Bill 179, you had an amendment, Senator Reardon. Is that language?
We have the language, Senator Pearl, or Senator Gray is very adamant about holding.
Hold it, okay.
I got an email.
All right, we'll just hold it then. Yep, okay. So 179's on hold. I have not seen my amendment on 185 yet. It was supposed to be in by 9. I believe that's our last bill, right? 185 for right now?
202.
Did we do two? Oh, no, you're right. Oh, we have 286 too to do. 202. Okay, we can do today's. Yeah, I'm sorry. I was looking back on the sheet. All right, so 189 is the one she wanted us to hold.
170.
No, I'm sorry. Today that we heard. She asked us to hold for an amendment.
I'll move on. That's on 202.
On 202, sure, we can do that.
Can do that one.
So Senator, we'll do 202. Senator McHugh has moved on to pass. Do we have a second?
Second.
Second. All right. Discussion. I think this is definitely a much-needed bill, and we heard very compelling testimony that from all of the folks that it is very needed, and so I'm very happy to support it.
Good.
Further discussion. See none? All in favor? Aye.
Aye.
We move consent? Moved and seconded. All in favor? Aye. Senator McHugh, would you like to take this one out as well?
Yep.
All right, 202. Thank you again.
Thank you.
All right, let's go back and do 190. This is the State Health Improvement Advisory Council and the Commission on Interdisciplinary Primary Care Workforce. That is a mouthful. Do we have a motion? Do we have a second?
If you're not already exec one night,
Did we do 190 already?
I have off pass for.
Oh, my apologies. I did not check in on my other sheet here. I'm sorry. Thank you, Kevin. See? Yep, we did. My apologies. I had 2 sheets I'm working off from. Okay, 192. This is the last one we heard of. Oh, no, we did that one first. Got it. All right. This is the problem with having 2 sheets you work off. All right, let's do 286. This is the New Hampshire Office of Film and Creative Media.
286 or 186?
286.
286.
This is Senator Innes's bill. I'm going to move out to pass.
Even the Steven Spielberg bill.
Moving seconded.
I want to be an extra.
Discussion. We have an ought to pass motion. I am not certain myself how impactful this industry will be, this bill will be, and whether this industry really has legs in New Hampshire, but I'm very intrigued by it. I'm not certain how it's going to get through finance when it gets there, but I think as a policy, I'd sure love to have the film industry come to New Hampshire. I think it could be fun. I know there's a couple of films that we've talked about in the past, and So I'm supportive of it, and we'll see how it, navigates the rest of the system. Oh, thank you, Ryan. Further discussion on 286, other than Senator Gannon wants to be an extra. All right, all in favor, say aye. Aye. Any opposed? Move consent. We have a second? Second. Moved and seconded. All in favor? Aye. And I'll take this one out. Okay, great timing. My amendment for Senate Bill 185 is here. So we will go to that one next. Sorry to jump around so much. And you have been presented an amendment. And so I'm going to move on to pass on the bill.
Second.
And then I am going to move ought to pass on Amendment 485S. You have a second? Second. All right, I'd like to discuss what I did. So we had testimony from the Board of Realtors and OPLC and some others on this bill about challenges that have existed within the department on backlogs of cases and many issues they've had and about getting information out to the public relating to the hearings. I took into great consideration the testimony received and additional conversations that I've had with the stakeholders and with the and with the director of OPLC after our meeting. I've made some changes to the bill. Specifically on lines, so the first part of the bill, they felt they did not have a huge issue with complying with. They were essentially doing that anyway. I have to check on something here. I apologize, this is the first time I'm seeing this too.
60 days to 90 days.
Yeah, there's a mistake in this amendment. In the first part, that 60 days was supposed to remain 30. Yep. So we're going to have to correct this. This is going to have to be a committee amendment, Kevin, but it's going to be based on Amendment 485. So on line 5, that should be 30 days, not 60 days, as it was in the original bill. Then on line 17 of the amendment, yeah, I know I almost did the same thing because the original bill was 15. I have moved the 60 days to 90 days. Because I was sensitive to the testimony that we received from OPLC that this might be challenging for them to comply with. But I believe in moving this to 90 days, we create a workable solution that they can live within. I've left the 60 days on line 20 because that is relating to the investigation being incomplete, and that's the board portion of whether they want to continue on with the information they have or decide to send it back and complete the investigation. And we didn't receive any testimony that that 60 days was a challenge for the board to meet, so I left that at 60. The other major change that I made is being sensitive to the backlog of cases that are there. There's approximately 3,000 cases that are still in backlog. The director was quite sure that moving through the first portion of this bill and looking at those cases and deciding whether they had merit to go forward, that she'd be able to, get rid of a lot of those 3,000 cases because they probably didn't have merit. Obviously she hasn't reviewed them all, but that was the sense that there would be many that would be able to just not move forward and be dismissed. But there still will be some remaining ones, and what I didn't want to create was a situation where we had a two-tier system that if we enacted this too quickly and didn't give them an opportunity to work through their backlog, that we would have cases, old cases, that would now have to take a back seat to new ones in order for them to comply with the new language we were putting in. So what I did is I moved the effective date out on that portion of this bill until March 1st of 2026, which effectively will give them, it's over a year from now, but it will give them effectively 9 months after this bill would be signed into law to get through that backlog of cases. I'm not certain that's enough time, because they're not certain if it's enough time. But the other thing that it does is it gets it far enough into the legislative process of next year that if we get to that point, we get into fall, and they still have such a huge backload, they don't feel they can comply with that, assuming this is signed into law, it would give us the opportunity to put another bill in and edit that if necessary. So that was my thinking in putting the implementation date out that far.
Does anybody remember how long they said on average it takes start to finish for one of these cases, from complaint to resolution on average?
It's very difficult to come up with an average because it depends. You're talking about, so there's over 58 different boards that they're overseeing, and so if it was something to do with a healthcare issue, it could, a malpractice or something, it could take a long time. But I don't know that there's been an average compiled, because it depends on how many of the cases are within a particular field and how quickly they can dispose of those. So it's difficult to, I'm sure there could be a number that was quantitated, but I don't know that's been done. So
anybody have a sense?
I'm going to agree with the chair that the subject matter is so different in all of these cases, and there's so many that are just dismissed. When you receive them, you realize it's a vent, it's not a complaint, and are dismissed, that the numbers were skewed, and I think the director attempted to explain that.
And they're essentially complying with that 30-day portion in the beginning already.
Yep.
And that was testimony that I believe she gave here. I certainly, if she didn't give it here, she had it in conversation with me, and I believe she gave it here in testimony, public testimony.
So the numbers are skewed by the large number that, like you said, are just venting and don't really require,
don't meet the standard of a complaint.
Yes. Right. Yeah. So on the face of it are dismissed, and that they have 30 days to determine prima facie dismissal or whatnot. Okay. Yeah. So what's the sense of the group or the board or the department of what's a reasonable length of time, start to finish, add up all the periods provided in the statute? What's the sense of this group for how long it should take someone for a valid complaint, right? So make the basic assumption that it's legitimate, that the complaint is legitimate. How long should it take?
So it depends on the complaint, because sometimes the investigation takes years to complete, and that's the challenge. And so what this does is it kicks it back to the board.
That wasn't my question. My question is, all comers, what do you think should be the average amount of time for a legitimate complaint? Like what's, on average, how long should it take? Should it take 30 days?
180 days, start to finish.
You did the math. Yeah, I did the same math, and it's 6 months. So you agree that, because we're putting in 6 months.
Perfectly reasonable, and as I said,
for both parties.
For both parties.
Yeah.
But
I'm asking because I don't know.
But with a mechanism to
So the main thing this does is this puts some parameters in place so that there's at least some deadlines to meet. That's the biggest thing that it does. And it gives full power to the board to say, you know what, we want you to continue to investigate this, but you've updated the board and now we know where we are. And that is good for all.
And previously, several of these deadlines didn't exist.
They don't.
It was just
there are cases,
infinite.
There are cases that are 3+ years old.
Yeah, okay.
And so
you like
this is putting some parameters within for them. Now again, listen, this may go to the House. The House may have a different take on it. I don't know. Seemed to me like we were in a good spot. We really considered everything, all the information that were given, and I felt this was a fair and reasonable way to put some guardrails, so to speak, on the process.
I mean, 6 months seems like a long time if it's affecting your income, but not a really long time if many times it could be less. And also, given the volume and the fairly limited resources, it seems like a fairly good compromise. But I really have no frame of reference, so that's why I'm asking some of you guys that might.
Well, I've worked, and this is my third year now working in this area, and I've worked with two different directors, and certainly we've met with many of the boards, and I don't know if this is exactly right, and in all cases, it may not be. But it gives the latitude for the some latitude to the boards to say, keep going, we like what you're doing, or, no, we've had enough, we want to make a decision.
Yep.
And that gives them the ability to do it.
I think six months is a good starting point then. All in 30, 90, 60.
So this will now be a committee amendment because of that mistake, but you're going to use the basis of this with the, on line 5, changing from 60 back to 30. So you use the basis of the amendment, 485. All right, you clear on that, Kevin? All right, good. Further discussion on the committee amendment? Seeing none, all in favor? Aye. Any opposed? So now this will be ought to pass as amended, which I moved, and I apologize, I don't recall who seconded. Senator Reardon seconded. So further discussion on the bill as amended with the committee amendment. Hearing none, all in favor?
Aye.
Aye. Any opposed? I'll move consent.
Second?
All in favor?
Aye.
And I will take this one out since it's mine to explain
Near
if
and
someone
dear
has
to
a
your
problem. All right. So,
Nicely done.
thank you. 185. Let me just review my notes here, but Kevin, do you agree that the only bill that we've had a hearing on that we have not exec is 179?
Yeah, 179 and then the one Prentice.
Yeah, oh, I'm sorry, yes, yes,
Those are the only two.
yes. All right. Anything else you all want to discuss before we move out of exec? I have an amendment to Senate Bill 183, which is the Peace Development Authority, but you know what? I will distribute this. I'm not acting on this today. I brought it more. I had it drafted more so that I've had conversations with Senator Altschiller about a possible solution or a compromise to.
Is it the advisory council?
Yes. So I'm going to pass this out to you, but understand this is only a draft, okay? It's something I put together so that you could all see what I had in mind, and I want to make sure that we are working fully with Senator Altschiller on this bill. So here's the thought I have, and I'm going to leave it at that. And anything else you want to discuss before we go out of exec session? All right, seeing none, I'll take a motion to go out of exec. All in favor?
Aye.
Aye. And with that, I thank you all. That almost completes our FNs. We have just one left, number 179. We will be meeting again, I think it's March 5th. Is that the Wednesday? Our deadline? I believe it's March 5th, whatever that Wednesday is. Yeah, all right, March 5th, we'll be meeting again. I'll schedule more hearings, and we will have to exec 179 on that day, because that will be right in front of our deadline. With that, yep, you sure can.
For your amendment?
Yes.
So that'll leave the people appointed, the local people have one less member?
No, so the local people, if it's done, I'm sorry, I haven't had a chance to review it, it just came in. What it will do is the one seat that was for local people, because originally it was for Greenland and Newington, and this would also add Hampton and Rye, so that you'd have one local seat, and that would not change the makeup of the board, but it'll expand the footprint of the local input, and it would also give 2 more seats on the Ports and Harbors Advisory Council, which would give a greater voice for those 2 communities again within that.
So if I understand correctly, there's the Peace Development Authority has the same size board.
Same size board.
It's that local member makeup now just comes from a bigger geographic
Correct.
footprint. Thank you.
That was my compromise.
Yep.
And I've discussed this with Senator Altschiller, and I've asked her to go back to the communities and discuss it with them. She has not been able, she hasn't given me feedback on it yet, but I had this drafted so that it would be in writing and you could all see what my thinking was.
Would you entertain putting in, Seabrook?
Absolutely. This is just, again, a conceptual draft, so I'm looking for input from all of the committee, and this was a way that I thought was a good compromise from the testimony that we received.
So if I understand Senator Reardon's interpretation, the member of the PDA is a single member appointed
by 4 communities
jointly
instead of 2.
Got it. So
Yeah.
four towns get together and decide who the one person is.
Yes.
Good.
Instead
Got
of the
it.
2.
And then
that keeps the local representation the same.
And then separately, you're adding
Like advisory council.
2 members
to the Ports Advisory Council.
to the Ports and Harbors Advisory Council.
Yes. And that
Still
gives,
an even numbered.
and that gives greater voice there. Yeah. So that's what I've attempted to do. I just got this, and
Good
I'm hoping
compromise.
it's drafted. So again, I'm looking for some feedback and input from Senator Altschiller on this, as it's her community and her bill. But that was my compromise. All right. Well, with that, we are done for today. Thank you all for your great work, and Zach and Kevin, the same for you. We appreciate it. Everyone, have a good rest of your day.
HHS is still backed up enough that I